Hi, my name is Dr. Ali Mardi, founder of the website Blood Academy. I want to welcome you to this video, an opportunity to learn more about the Royal College of Pathology FRCPath Haematology exams. Before we start, remember to subscribe to our YouTube channel and social media pages to keep updated on all our awesome content. You can also join over 1,000 registered users who have already benefited from our website and start your revision today. In this video, we speak to 5 haematology trainees based in the UK who have recently passed these challenging exams to get their tips on passing. Before we speak to them, let's look at how these exams are structured. The exams are made of 2 parts that test knowledge and application in the 4 main disciplines of haematology: hemato-oncology, transfusion medicine, general haematology and coagulation. The Part 1 exam is a 1-day theory exam made up of 2 papers. One paper comprises 4 compulsory essays, whilst the other of multiple choice and extended matching questions. Both papers are 3 hours in length. You will be required to pass the Part 1 exam before being able to apply for the Part 2. The Part 2 exam is spread over 3 days. Day 1 specifically examines your morphology and diagnostic skills with 2 papers. The first is made up of 12 quick-fire short cases and the second 3 more lengthy long cases. During day 2, you are given papers on transfusion and coagulation. The final day concludes with an oral exam or viva. There are 8 topic areas to be answered in 60 minutes with 2 30-minute oral exams with 2 pairs of examiners. Now you know how these exams work, let's get the first-hand advice of our trainees on how they passed.
A good way I prepared was forming a study group, and actually this goes for Part 2 as well. And I think that has a number of benefits. Firstly, it makes it a bit more sociable. Sometimes when you're feeling a bit low or you don't want to revise, having someone else or a group of people there who have revised can push you along a little bit and make you feel like it's a communal effort. And I think what can happen is conversations and discussions about cases you've experienced often help you remember. So, for example, a colleague discussing a case with me, I tend to remember that better than perhaps just reading a guideline or reading a textbook. So I think certainly forming a study group is one of my huge recommendations for both Part 1 and Part 2. I'd say, unfortunately, the cliche for a lot of these exams is reading the BCSH guidelines, and I'd certainly say that's of benefit as well, although sometimes they can be a little bit dry and long, but certainly that forms a core curriculum for what you should have to learn. Textbooks can be helpful, and for me it helped me structure my thinking and make sure I didn't miss any points. But you know, after a while or reading a lot of paragraphs, you find that a lot of the information, or at least for me, didn't necessarily stick. Courses can be useful for Part 1, and there are a number of courses around the country that help. And then I'd certainly say the last bit of advice would be to do practice questions. So there are various websites available, including Blood Academy, but certainly some books are available. And if you can look at previous essays, I know the FRCPath has some sample essays. Looking at essays and MCQs can be really helpful. And if you've got some nice colleagues and consultant colleagues who'd be willing to mark your essays, certainly I'd recommend doing a few of those essays under timed conditions. It's not very nice and it feels a bit artificial doing it, but I'd find that, you know, that's really helpful, and getting some feedback as well. Most consultant colleagues are kind and helpful and will give you good feedback on your essays. And, you know, a lot of us, I think, have not necessarily written essays for, about 10 years perhaps. So getting into the practice and routine of writing essays is incredibly helpful.
Okay. So for Part 1, or I think to say for both of them, for Part 1 and Part 2, so I think I started revising for both of them probably about 3 months before the actual exam, and I did do like a revision timetable to set out what I wanted to cover and kind of tried to timetable in for the weekends what to do, because there is a lot to get through, and I think you do kind of need a bit of a schedule of how you're going to cover everything. So, and it's also, I think it's also quite important to know the format of the exams, which I had no idea about before actually starting. So for part one, you've got your 4 essay questions. So you do need to have quite detailed knowledge about the different topics, so the coagulation, transfusion, hemonc and general heme, because if one of those comes up as part of one of the essays, you do kind of need quite detailed knowledge about that. And then the second part of the exam is the multiple choice questions and the EMQs. So, and you can sort of revise for those, I think, probably quite differently. So how did I prepare for part one? I think I focused a lot of it around looking at the BSH guidelines, which is very dull. It's not the most exciting revision, but particularly looking at the more recent guidelines, because those are the sort of things that can definitely come up as an essay question. So it is good to know them quite well. But yeah, as I said, particularly the more recent ones or some of the hemonc ones. So I think I basically did go through pretty much the entire backlog of guidelines on the website. I mean, you don't need to read page to page all of them, but like they all have summary points and recommendations. I think, yeah, I went through pretty much all of those. And so that's kind of the basis for both the essay questions and the EMQs and the MCQs. But then there's lots of other websites as well that you can get sort of practice questions on. So, and there's also books as well. So I think I used like for EMQ and MCQ practice, there's the Barbara Bain, I can't remember what it's called now, I should probably have got that, but there's a little Barbara Bain handheld pocket book that has got lots of questions in. And then there is the Blood Academy website that does have a really good question base. And again, there's another one that I think I used that, again, I also can't remember the name of, but if you look, there are some online that have got lots of question banks. And trying to think of other websites that were very useful. I think HemeBase does have a good summary of pretty much all the BSH guidelines. So if you don't want to read through all of them, I think that does summarize all of the guidelines on there. But yeah, I did go through all of the guidelines. And I think in terms of other preparation, so I think one of the big things on the day that everyone kept saying is timing. So you need to, so I practiced doing mock essay questions, and the consultants are actually genuinely very willing to help, either to sort of make up questions or to find past questions that you can do at home to time, and then, well, initially not necessarily to time, but by the end, if you can practice doing them to time, obviously without any notes, and then getting someone to sort of read and mark them, that was really good. And even if it's not to necessarily get a proper mark, just someone to say that this is what, this is you're on the right tracks. Otherwise you could sort of go into the exam without really knowing quite how to structure the essay or what you're meant to be doing. So definitely doing practice essays is very good. And as I said before, I think you need to have quite a good background knowledge for doing those essay questions, hence having to look at all the guidelines. And I think certainly when I started prepping for part one, you kind of have the feeling that you don't know anything, because you might be doing it fairly early on. I think I did it fairly early on I did it as I was in ST4, so you might actually feel when you start that you don't really know anything, and it can be quite daunting then to be trying to do practice questions when you think you just don't know anything. But by the end of the revision, it will come, and then you will actually feel like you've learned quite a lot, which was quite nice about doing part one, that then you did actually feel that you've definitely learned, and now you actually understand some stuff, whereas before you probably didn't really. And I think the only other thing to say about my preparation for part one was that I think I did most of it just by myself. I mean, I know some people might find you work really well as part of a group, but and you certainly could do it as group revision, but equally it's the sort of exam that you can just do kind of by yourself and sit and do your revision timetable and just kind of get on with it yourself, I think. So I guess everyone's different.
Part two, I was really fortunate to have a study buddy. So we would just, with Zoom, we'd go through coagulation and transfusion, really. And then morphology, it was our little group that would meet up on the weekends. The thing with morphology, and I was quite fortunate with our group, but I know with previous groups, you can learn bad habits because you don't have someone overlooking you. So you just need someone who thinks, oh, well, this is how you do morphology, and then everybody else picks that. Because I don't know how you found it, but there would be groups where all of them would pass or all of them would fail, and you sort of wonder why that's the case. So I kind of feel that with morphology, if you could do it with a consultant or someone who is very good, then they could actually teach you how to write your answers. Actually, there wasn't that many marks for the diagnosis. It's actually describing. And there were moments when I'm like, what are they asking from me? You know? And I think when you're doing it as a group, all you think about is getting the diagnosis, but actually that's not the marks you get. And also the time, I just felt rushed to try and get through the slides. And you don't realize that 5 of the slides are going to be taken away from you. And you're never going to look at it again. So you have to get over yourself and go, right, okay, well, whatever I wrote for those answers, I need to concentrate in the next 5 slides. And the stamina to go through the second day and the third day, because again, I don't know how the others felt, but I thought morphology was the toughest. And at the end of that day, I just thought, I'm going to give up. Why should I bother? And I was like, okay, it's fine. I'll just keep going. I'm so glad, because actually my marks actually got better and better, which is why I think I passed. I think if I had the same feeling of like, oh, I'm going to give up, I don't think I would have passed.
It's a very different exam to anything that you'll have ever done in medicine, but partly because of the way it's set up in terms of morphology. I'd never done an exam that involved a microscope before. In terms of practicing for a vivas, I'd never really done vivas before. And again, it was using the different resources. So Blood Academy, again, was very good in terms of practicing the SAQs, and also having a slide bank, so I could look at a lot of the slides for known malignancies and help consolidate my knowledge. Obviously, we had sessions as a group online where we went through cases of morphology and talked around them, which was really helpful. Consultants again in the hospital did viva practice with me, quite a lot of coag, because coag can be difficult, but when you get good teaching, it actually becomes quite straightforward. But I think it's a lot of it is, rather than necessarily book work, it's talking to people, it's practicing, looking at HPLC plots where you can, getting actively involved in discussions about diagnostics such as flow cytometry. So it really is a bit of a combination of things that you have to do, as well as reading the up-to-date guidelines and any new research coming out. Because we were doing it around the time of the pandemic, we used Zoom a lot to have discussions with each other. And we did that particularly in the last couple of weeks before the exam. We'd speak most days and talk through different topics. So actually, despite being on my own in Cardiff and Wales doing the exam, I could still work with someone else by using technology.
Things that suggest for part 2. So forming study groups is incredibly helpful. A lot of the resources that I mentioned in terms of Blood Academy, Heme-based is an excellent website, which I use particularly for reading short notes, the BCSH guidelines, textbooks. So one book, it's quite big, but it's practically based, is the ASH educational textbook, which is released every few years, and it's part of the educational program. And that's quite useful. There are certainly some excellent chapters in there, and it's kept relatively up to date every few years. So I'd certainly recommend that. And then, again, it's a bit of a cliche, but certainly revising for it felt a little bit like it's about a summation of your training over many years. And that particularly is true for the morphology. So the other tip that I'd recommend is spending some time, and again, lots of people will tell you they're spending some time in the laboratory looking at blood films. And of course, a lot of the blood films that you might see in the exam are perhaps not ones you'll ever see when you're training. But as long as you've got a systematic approach to reporting cases, which you'll build up throughout your training and presenting to consultant colleagues and writing blood film reports, bone marrow reports, trephine reports, lymph node reports, that'll stand you in a good position when it comes to the exam. If you have got access to quality assurance exercises that your local hospital does, so certainly in London, we benefit from, in the area that I trained in, it from NECWAS, and the hospital that I worked in kept NECWAS slides from previous years, including questions and answers. And those slides include some of the common things and the uncommon things that you don't necessarily see in clinical practice that do come up in the examination and are incredibly helpful. And in particular for some of the other laboratory techniques apart from blood films, I remember spending some time with the coagulation scientists in my local hospital, and that was very helpful, at least in essence, to visualize the coagulation assays that are being performed. And whilst practical hemostasis is a mainstay for a lot of our training, is an excellent website for both part 1 and part 2, certainly added a bit of life to that resource. As part of the study group, we formed a virtual microscopy study group, and that was incredibly helpful as well, partly due to COVID, meant that we couldn't necessarily study in close groups, but finding ways to get around, not being able to study together, and hopefully virtual microscopy will become a mainstay of most of our teaching. And then the final thing that I remembered was podcasts. So it's something that I discovered relatively recently, and particularly when I'm commuting to work, listening to a podcast, normally between half an hour and an hour, incredibly helpful. Again, it gets you into a feel of the Viva, talking about clinical scenarios, questions, and they were very helpful. So for example, the Bolus podcast, which is, I think, run out of Birmingham, I think. And there's a UCH one as well. Excellent resources, I'd recommend them.
For both parts, I actually again get some study buddies, and I had a few. And what I find useful is, I was lucky when I was doing the exam that there were a few of us from the same rotation. But for my part 1, I actually got to know trainees from different deanery in the 3-week intermediate transfusion course. And actually, we stayed an hour after every day of the teaching to discuss a few topics. And in 3 weeks, we actually had 15 hours of revision. And I find that was really useful. And it was with a trainee whom I've never met, and only met for the first time in transfusion course. So I think my advice is, do not be afraid to speak to other trainees. They might have tips. They might be able to study with you, especially if you haven't got anyone else to study together. Do not miss the NHSBD transfusion courses. They are absolutely vital for preparing for both parts. And specifically for part 2, I suppose we should identify the microscope that you want to bring to the exam and bring it home, or at least get familiarized and learn how to troubleshoot the microscope should there be any problem. I was lucky when during my exam that the college provided the microscope, and it was really good. And if you are being offered the microscopes from the college, I think it's reasonable to take up that offer. It's really, really good microscope quality, and I had no issue with that. I think consultants are our good friends, so always use them. They really help tremendously, not just preparing question marking the essay for part 1, but I had many good sessions, especially in Viva, with my consultant. And as for part 2, we had discussions about lab management and how do we manage NECWAS and topics like that, which we don't really learn from our day-to-day unless we actively approach the consultants. And I think at the end of the day, on the exam day, just know that you have tried your best preparing for the exam. don't put yourself down. Do not dismiss the effort that you've put in. Be calm and you'll be fine. And that's my message for all.
I spoke to one of my friends recently who'll be doing the exam in the next year, and I said, really, I just think you have to commit to doing it. You have to decide that you're going to do it, and you really have to throw yourself into it. You have to be willing to go and find people to do extra teaching with you. You have to be willing to go to the lab, and you have to be willing to sit down and look at lots of morphology, slide after slide after slide. And I think if you commit to it, you'll be okay. But if you sort of do it quite half-heartedly, that's when you're going to fail. So you really have to commit to the idea of doing it, and then just throw yourself into it. And I think it can be quite enjoyable, because you really do feel like you're at the height of your haematology knowledge. So it doesn't have to be a massive or stressful thing, but if you're not committed to it, then I think that's where you'll struggle. So I think you really have to decide you're going to do it and really go for it.